In a remarkable feat, Swagat Super Speciality Hospital has successfully conducted its first liver transplant surgery. The recipient is a 38-year-old man who underwent the complex surgical procedure with his brother-in-law serving as the donor. Both individuals are natives from Manipur. The hospital secured special permissions according to protocol from both the Manipur and Assam governments, emphasizing the collaborative efforts required for this transformative medical achievement. A liver transplant is a sophisticated surgical procedure designed to replace a diseased or damaged liver with a healthy one from a donor. This complex operation is typically performed to treat end-stage liver disease, liver failure, or specific liver cancers. The process involves a meticulous evaluation of both the donor and the recipient to minimize the risk of complications. Well, talking about the successful liver transplant, CMD of Swagat Super Speciality Hospital, Professor Subhash Khanna, said that many patients have to go outside Northeast for such transplantation. But with such a groundbreaking feat achieved, the patients can now come to Swagat Hospital in Guwahati instead to undergo treatment, thus reducing the cost as well as the trouble taken to go outside Northeast.
Now, this patient and the donor are blood relations. They are from Manipur. So the patient came to us about 9 months back. He approached us with, we call it an end-stage liver failure, end-stage liver failure. So at that time he was having slight blood vomiting with a lot of fluid in the abdomen, which is quite typical of a patient with chronic liver disease. We started taking out fluid from the abdomen, and we also started treating him so that he doesn't vomit more blood. So from that day onwards, the patient knew that he had somehow confidence in us. He was convinced that and became ready to undergo transplant with us. Maybe the cost was a factor because we offered him at the cheapest possible rate, which is compared to the other centers of the country. Now he is there with us for the last 15-20 days. He is being prepared, both the donor and the recipient. So then we started preparing both the donor and recipient with all the investigation. Surgery was started in the early hours of 23rd of December and completed past midnight of 24th of December. It took us about more than 20 hours to complete the whole procedure, and the whole operation theatre area was cordoned off. There was no other surgery allowed on that day, and we could do this surgery accomplished successfully. What we are going to do is we are going to give a specific particular number only for transplant number. If you just, that will be shared with you. So just click that number, and our transplant team, one of the team members or one of the officers will take up that call and help you over the phone. What I want to say is, anytime a person needs a transplant, he can come to us, and we are ready. We are all prepared to provide the services.